In the next 5 minutes while you're reading this, 12 seniors will suffer a heart attack, and nearly half will be completely alone when it happens. What if I told you that 65% of heart attack deaths in people over 60 occur before they even reach a hospital? The devastating truth is that most seniors wait too long, dismiss the symptoms, or simply don't know what to do in those critical first minutes when every second counts. But here's what gives me hope after 4 decades as a cardiologist. Knowing just these 7 specific actions can literally double your chances of survival. I'm sharing the exact protocol that saved a 74-year-old woman's life when she collapsed alone in her kitchen last winter, and the same strategies that have helped hundreds of seniors just like you turn a potential tragedy into a survival story. If you're watching this video, please hit that like button right now. You never know whose life you might save by sharing this information. And if you're new to our channel, where we tackle the real health challenges facing seniors, make sure to subscribe and ring that notification bell. You might think you know what a heart attack looks like. Perhaps you've seen the dramatic Hollywood version, where someone clutches their chest and collapses. But here's the shocking reality. If you're over 60, your heart attack might feel nothing like that at all. It might whisper instead of scream, leaving you confused and vulnerable in those precious moments when every second counts. Let me share this woman's story with you. At 74, she was preparing dinner when she suddenly felt what she described as bone-deep exhaustion and mild nausea, no chest pain whatsoever. Because we had discussed these senior-specific warning signs, she didn't dismiss it as just being tired. She followed the exact 7-step protocol I'm about to share with you. Today, she's alive and well, gardening again, and she credits these strategies with saving her life. Your heart has been faithfully beating for 6 decades or more, and understanding how it calls for help in your later years could literally save your life. The signs aren't always obvious. The response isn't always intuitive, and the stakes couldn't be higher, but you're not powerless in this fight. Today, we're going to explore 7 critical strategies that every senior should know, not just to survive a heart attack, but to emerge from it with the best possible outcome. These aren't abstract medical theories. They're the exact same life-saving actions I teach all my patients over 60, and they've helped countless people just like you turn a potentially fatal situation into a survival story. Before we dive in, let me know in the comments, have you ever experienced symptoms you brushed off that might have been your heart trying to warn you? Your story could help someone else recognize the signs. Strategy 1. Decode your heart's secret warning system. Your heart at 60 speaks a completely different language than it did at 30 or 40. After decades of faithful service, it has developed its own subtle way of signaling distress, and recognizing these signals could mean the difference between life and death. Here's a statistic that will shock you. Nearly 40% of seniors experiencing a heart attack never feel the classic crushing chest pain at all. According to the latest American Heart Association research, your heart might not scream in agony. Instead, it whispers its distress through seemingly unrelated symptoms that are dangerously easy to dismiss. This isn't a failure of your body. It's simply how aging changes the way your nervous system communicates emergencies. Think about how your body has evolved over the years. Your joints might signal differently, your energy patterns have shifted, and your sleep has changed. Your heart's emergency signals have similarly evolved, becoming more sophisticated but also more subtle, which makes them incredibly dangerous to ignore. The first life-saving strategy is learning to recognize these whispered warnings before they become screams. Sudden, unexplained fatigue that feels fundamentally different from your usual tiredness might be your heart struggling to pump blood effectively. If you find yourself exhausted after activities that yesterday felt effortless, or if you feel profoundly drained for no apparent reason, your heart might be sending an urgent SOS signal. Breathing difficulties often creep up gradually, like a thief in the night. You might notice yourself getting winded walking to your mailbox when the same walk felt easy just days before. This isn't necessarily about fitness or being out of shape. It could be your heart working overtime to circulate blood through your system when something is going wrong. Here's what many people don't realize. Unusual sweating, especially when it feels cold and clammy, often signals that your body's emergency response system has activated. This might happen even when you're sitting quietly in a comfortable room. Your body is desperately trying to help your struggling heart, and sweating is one way it attempts to regulate this internal crisis. Digestive symptoms can be the most deceptive warning signs of all. Many seniors experiencing heart attacks initially think they're dealing with indigestion, acid reflux, or stomach problems. That uncomfortable feeling in your upper abdomen, sudden nausea, or general digestive unease might actually be your heart's desperate plea for immediate attention. Changes in your mental clarity deserve immediate concern and should never be dismissed. If you suddenly feel confused, lightheaded, or unusually disoriented, especially when combined with any other symptoms, don't assume it's just a normal part of aging. Your brain depends on steady blood flow to function properly, and when your heart struggles, your thinking becomes clouded. Pain that appears in unexpected places, your jaw, neck, shoulders, arms, or back, might be your heart's distress signal traveling along complex nerve pathways. This referred pain is incredibly common in seniors and often leads to dangerous delays in seeking help because people don't connect these symptoms with their heart. Most importantly, trust your deepest instincts. If something feels fundamentally wrong with your body, even if you can't identify exactly what it is, listen to that inner alarm. Your body has decades of experience keeping you alive, and when it sounds a warning, that warning could save your life. Which of these warning signs surprised you the most? Share in the comments below, and don't forget to share this video with someone you care about. It could literally save their life. Strategy 2. The golden rule that doubles your survival chances. When you suspect your heart is in crisis, every single second becomes precious beyond measure. The second life-saving strategy centers on one critical action that research shows can double your chances of survival: calling for professional help immediately without any hesitation or second-guessing. Here's a sobering medical fact that changed how I practice. For every minute that passes without treatment during a heart attack, more heart muscle dies permanently. After just 10 minutes, the damage may begin to become irreversible. After 30 minutes, significant permanent damage occurs that can affect the rest of your life. Many seniors hesitate to call 911 because they worry about embarrassment if it turns out to be a false alarm. Let me be absolutely clear. There is no embarrassment in protecting your life. Emergency responders would rather respond to 100 false alarms than miss the one call that could save a precious life. Your independence has served you well throughout your life, but this is absolutely not the moment to rely on it. Driving yourself to the hospital might seem like the practical thing to do, but it's one of the most dangerous decisions you could make during a heart attack. Your condition can deteriorate in seconds, and if you lose consciousness while driving, you're not only risking your own life, but the lives of innocent people on the road. When you dial 911, treatment begins the moment they answer the phone. Modern ambulances are essentially mobile intensive care units equipped with advanced medications, monitoring equipment, and life-saving devices. Paramedics can administer clot-busting drugs, provide oxygen therapy, and use defibrillators if needed. They also alert the hospital, ensuring that a specialized cardiac team is assembled and ready the instant you arrive. Let me share what happened to one of my patients, a fiercely independent 76-year-old gentleman. When he felt chest discomfort and shortness of breath, his pride convinced him to drive himself to the hospital. Halfway there, he lost consciousness and crashed into a guardrail. Fortunately, a passing driver called 911, but this added critical minutes of delay and caused additional serious injuries. Later, he told me with tears in his eyes, "Doc, that was the most foolish decision I've ever made in my life." After making that crucial call, immediately prepare your environment for the arriving help. If you're physically able, unlock your front door or ask a neighbor to do so. Emergency responders need instant access to reach you, and precious life-saving minutes can be lost if they can't get inside quickly. Stay on the phone with the dispatcher whenever possible. These professionals are specially trained to guide you through these critical moments and can provide specific instructions tailored to your exact situation. They might talk you through positioning techniques, breathing exercises, or other immediate actions while you wait for the ambulance to arrive. If you have a medical alert system, activate it immediately in addition to calling 911. These systems often connect you to operators who can stay with you until help arrives, providing an additional layer of support and continuous monitoring during this frightening time. Consider calling a trusted neighbor or family member after you've contacted emergency services, but only if you can do so without delaying other critical actions. Having someone nearby who knows about your situation can provide both practical assistance and emotional support during these terrifying moments. What's your current emergency plan? Do you have someone who regularly checks on you? Let me know in the comments, and if this tip was helpful, please give this video a thumbs up. Strategy 3. The 5-minute miracle drug in your medicine cabinet. The third life-saving strategy involves a common medication that's probably sitting in your home right now, but how and when you take it could literally mean the difference between life and death. Aspirin taken correctly during a heart attack. During most heart attacks, a blood clot suddenly blocks one of the crucial arteries supplying your heart muscle with oxygen-rich blood. Aspirin works by preventing blood platelets from sticking together, which can help stop the clot from growing larger and may even help restore some blood flow to your starving heart muscle. Here's something that could save your life. Research published in the prestigious Journal of the American College of Cardiology shows that taking aspirin correctly during a heart attack reduces death rates by up to 23%. But here's the critical part. It only works if taken correctly and immediately. Let me tell you about a 68-year-old woman who remembered to take aspirin when she experienced heart attack symptoms, but she made 2 potentially fatal mistakes. She took it with a full glass of water, which significantly delayed absorption, and she swallowed the aspirin whole, which also dramatically slows the life-saving effect. When we reviewed what happened during her follow-up appointment, she was shocked to learn the correct method that could have made the difference between life and death. Here's the exact protocol that could save your life. You need 325 milligrams of aspirin. That's 1 full-strength adult aspirin or 4 baby aspirins. But here's the critical technique that most people don't know. Never swallow the aspirin whole. Instead, chew it thoroughly before swallowing. This allows the medication to enter your bloodstream in approximately 5 minutes rather than the 30 minutes it takes when swallowed whole. Take the aspirin with just a tiny sip of water, only enough to help you swallow the chewed medication. Too much liquid can dilute the aspirin and slow its absorption when every second counts. Immediately after taking it, inform the 911 dispatcher and later the paramedics about exactly what you took and precisely when you took it. There are important exceptions you must know about. If you're allergic to aspirin, have a history of bleeding disorders, or currently take blood-thinning medications like warfarin, you should skip this step entirely. Also, make absolutely certain you're taking actual aspirin, not acetaminophen like Tylenol, ibuprofen like Advil, or other pain relievers, as these don't have the same blood-thinning properties that can save your life. I recommend all my patients over 60 strategically place aspirin in multiple locations throughout their homes, your bedside table, kitchen, living room, and even in your car and wallet. In a cardiac emergency, you don't want to waste precious life-saving minutes searching through medicine cabinets or drawers. Some seniors worry about taking aspirin without direct doctor supervision, but during a suspected heart attack, medical research overwhelmingly shows that the life-saving benefits far outweigh any risks for most people. Emergency medical protocols specifically recommend this approach because the potential to save your life is so dramatically significant. Do you currently have aspirin easily accessible in your home right now? Let me know in the comments, and if this information was completely new to you, please share this video with your family and friends immediately. Remember, aspirin is not a cure for a heart attack. It's a critical bridge treatment that can improve your situation while you wait for professional medical care to arrive. Don't let taking aspirin create a false sense of security that delays other essential life-saving actions. Strategy 4. the position that could save your life. How you position your body while waiting for help can dramatically impact your heart's workload and significantly affect your chances of survival. The fourth life-saving strategy focuses on finding the optimal position that best supports your struggling heart during these critical minutes. This might surprise you, but how you position your body can literally be the difference between helping and accidentally hindering your heart's desperate efforts to keep you alive. Let me share what happened with one of my patients, a 77-year-old man. When he experienced heart attack symptoms while alone, he remembered seeing a movie where someone having a heart attack was laid flat on the floor. He did exactly the same thing, but this actually increased his breathing difficulties and put additional dangerous strain on his already struggling heart. When paramedics arrived, they immediately repositioned him. Contrary to what many people assume from movies and television, lying completely flat isn't always the best choice during a heart attack. Your optimal position depends entirely on your specific symptoms, and understanding these crucial differences can help reduce strain on your heart when it desperately needs all the help it can get. If you're experiencing shortness of breath, which is incredibly common in seniors during heart attacks, sitting upright with solid back support is usually most beneficial. This position allows your lungs to expand more fully and makes it significantly easier for your heart to pump blood efficiently throughout your body. Find a sturdy chair or lean against a wall with pillows positioned behind your back for support. For those feeling lightheaded, dizzy, or faint, a slightly reclined position works much better. Think of a comfortable reclining chair position, approximately 45 degrees, with your head and back well supported. This helps maintain crucial blood flow to your brain while not putting extra pressure on your heart muscle. If nausea accompanies your other symptoms, sit upright and turn slightly toward your left side. This position can help prevent dangerous complications if vomiting occurs and may provide some relief for your digestive distress during this crisis. Absolutely avoid any positions that require physical effort to maintain. Don't stand or walk around while waiting for emergency services to arrive. Choose a stable, comfortable position where you won't fall if you suddenly become dizzy or lose consciousness. If you're on an upper floor of your home, never attempt to go downstairs. The physical exertion could dangerously worsen your condition. Immediately loosen any restrictive clothing, particularly around your neck, chest, and waist. Tight belts, collars, ties, or bras can restrict breathing and blood circulation when your body is already under tremendous stress. This simple action can provide immediate relief and help your cardiovascular system function more effectively. Consider temperature regulation carefully. Heart attacks often cause sudden changes in body temperature, and seniors are particularly sensitive to these fluctuations. If you feel cold, cover yourself with a blanket, because shivering increases your heart's workload when it's already struggling. If you feel too warm, ensure adequate ventilation without exposing yourself to extreme temperature changes. Choose a location in your home that's easily accessible to emergency responders. Ideally, this would be near your unlocked front door on the main level of your home. If you live alone, consider establishing a daily routine of spending most of your time in areas that would be easy for help to reach quickly. Have you thought about where in your home would be the best place to wait for emergency services? Share your thoughts in the comments below, and if you're finding this information valuable, please hit that like button to help more seniors see this potentially life-saving content. Remember, these positioning strategies are temporary measures while waiting for professional help to arrive. They are specifically designed to reduce strain on your heart during those critical waiting minutes, but they absolutely don't replace proper emergency medical treatment. Strategy 5. The breathing technique that calms your heart. Your breathing becomes your most powerful ally during a heart attack, and learning to control it effectively represents the fifth, potentially life-saving strategy. When panic naturally sets in during such a terrifying experience, your breathing often becomes rapid and shallow, which can actually increase the dangerous strain on your already struggling heart. Controlled breathing serves multiple critical purposes during a cardiac emergency. It helps manage overwhelming anxiety, reduces your heart rate, lowers blood pressure, and dramatically improves the efficiency of oxygen delivery throughout your entire body. For seniors experiencing a heart attack, these benefits can be absolutely crucial for survival. One of my patients, a 71-year-old woman, credits controlled breathing with helping her survive until paramedics arrived. "When I felt that crushing pressure in my chest," she told me, "my first instinct was to panic completely, but I remembered the breathing technique you taught me. Focusing on my breath not only calmed me down significantly, but gave me something constructive and helpful to do while waiting for help to arrive." The 4-7-8 breathing technique offers a simple but remarkably powerful method for regaining control during a cardiac crisis. Start by sitting in your chosen comfortable position with your back well supported. Place the tip of your tongue against the ridge behind your upper front teeth and keep it there throughout the entire exercise. Begin by exhaling completely through your mouth, making a gentle whoosh sound. This helps empty your lungs completely and prepares them for the controlled breathing cycle. Close your mouth and inhale quietly through your nose while counting steadily to 4. This should be a smooth, comfortable inhale, never rushed or forced. Hold your breath for a count of 7. If you're experiencing significant shortness of breath, don't worry about achieving the full count. Hold for as long as feels comfortable, even if it's only for 2 or 3 counts. The important thing is establishing a steady rhythm that works for your current condition. Exhale completely through your mouth for a count of 8, again making that gentle whooshing sound. This extended exhale is absolutely crucial because it activates your body's natural relaxation response, effectively counteracting the panic and stress that naturally accompany a heart attack. Repeat this cycle at least 4 times, or continue until emergency services arrive at your location. If you find the counting difficult to maintain during this stressful time, focus simply on making your exhales noticeably longer than your inhales. This basic principle still provides many of the same life-saving benefits. The medical science behind this technique is absolutely solid. Extended exhales activate your parasympathetic nervous system, your body's natural rest and digest mode, which automatically slows your heart rate and reduces blood pressure. This is exactly what your stressed cardiovascular system desperately needs during a heart attack. Controlled breathing also provides a significant psychological benefit that shouldn't be underestimated. Focusing intently on your breath gives you something constructive and positive to do during those frightening minutes of waiting for help. It provides a crucial sense of control during a situation where you might otherwise feel completely helpless and overwhelmed. Don't worry if you can't perform the technique perfectly during this crisis. Even imperfect controlled breathing is dramatically better than the rapid, shallow breathing that naturally occurs during panic. The goal is meaningful progress, not absolute perfection, and any effort to slow and deepen your breathing will benefit your struggling heart. Have you ever used breathing techniques during extremely stressful situations? Share your experience in the comments below, and if you think more seniors should know about this potentially life-saving technique, please share this video with someone you care about immediately. Strategy 6. Last resort self-help when consciousness fades. The 6th life-saving strategy addresses an extreme situation that we desperately hope you'll never face, but knowledge of which could literally save your life. What to do if you begin losing consciousness during a heart attack while completely alone. Traditional CPR cannot be performed on yourself. It's physically impossible to maintain effective chest compressions while unconscious. However, there is a modified technique that some medical professionals recommend for extreme situations when you're alone and feel consciousness slipping away. This technique is controversial within the medical community, and I want to be completely transparent about that reality. Some doctors hesitate to teach it because of potential risks, particularly for seniors with conditions like osteoporosis or previous fractures. However, in a genuine life-or-death situation, where the alternative is cardiac arrest while alone, many medical professionals agree that attempting this technique is reasonable and potentially life-saving. One of my patients, a 74-year-old man, used this technique when he felt himself blacking out during a heart attack while alone at his remote cabin. He later told me with gratitude, I was absolutely certain I was going to die, Doc. Trying this technique gave me a fighting chance until my neighbor happened to hear me and called 911. If you feel yourself beginning to lose consciousness while waiting for emergency services, immediately lie down on a hard surface, preferably the floor rather than a bed or soft couch. The firm surface is absolutely essential for any compression technique to be remotely effective. Make a tight fist with one hand and place the knuckle side firmly against the center of your chest, directly over your breastbone. Use your other hand to push your fist forcefully against your chest, then quickly release. The compression should push your chest down approximately 2 inches deep, which requires significant force. Try to maintain a steady rhythm of about 100 compressions per minute. If you know the classic song "Stayin' Alive" by the Bee Gees, that's approximately the right tempo. This is the exact same rhythm taught in professional CPR classes because it matches the natural heart rate that provides effective blood circulation. Continue this technique until help arrives or until you regain more stable consciousness. The goal is to manually pump blood through your heart when it may not be beating effectively on its own. While this isn't nearly as effective as proper CPR administered by someone else, it may provide just enough circulation to keep blood flowing to your brain and heart during those absolutely critical moments. I must emphasize the very real risks, especially for seniors. This technique could potentially cause rib fractures, particularly if you have osteoporosis, previous bone injuries, or other bone-weakening conditions. However, in a situation where the alternative is death from cardiac arrest while alone, most medical professionals agree that these risks are entirely acceptable. This is truly a last resort technique for extreme situations only. Your primary focus should absolutely remain on the previous strategies: recognizing symptoms early, calling 911 immediately, taking aspirin correctly, positioning yourself properly, and using controlled breathing techniques. This self-compression technique should only be considered if you're actually losing consciousness and help hasn't arrived yet. Have you ever learned CPR or other emergency techniques? Share your experience in the comments and let me know if you think more seniors should be taught emergency cardiac procedures. If you're learning something completely new from this video, please give it a thumbs up and subscribe for more life-saving advice. Strategy 7. Your personal survival blueprint. The seventh and most crucial life-saving strategy must be implemented right now, while you're healthy and thinking clearly, creating a comprehensive, personalized heart attack action plan. During a cardiac emergency, intense pain, overwhelming fear, and reduced blood flow to your brain can severely impair your decision-making abilities. Having a detailed, pre-established plan completely removes the burden of making critical decisions when you're least able to think clearly. One of my patients, a 79-year-old woman, credits her advanced planning with literally saving her life. She had created a detailed action plan and reviewed it regularly. When she experienced heart attack symptoms while alone, she didn't have to think or make complex decisions. She simply followed her pre-established plans step by step. In that moment of absolute panic, she told me, having a plan I could follow without thinking made all the difference between life and death. Start immediately by creating a detailed emergency medical information card that contains everything first responders need to know about you. Include your full name, age, complete list of current medications with exact dosages, known allergies, existing medical conditions, and emergency contact information. Keep one copy in your wallet at all times and post another prominently in your home. Many people use their refrigerator door with a strong magnet. Strategically place aspirin throughout your home and carry some with you everywhere you go. Remember, it must be actual aspirin, not acetaminophen like Tylenol or other pain relievers, and preferably non-coated varieties that dissolve quickly when chewed. Consider keeping aspirin in your bedroom, kitchen, living room, car, purse, and wallet. Program your phone immediately with emergency contacts, using ICE, meaning in case of emergency, before their names, so first responders can easily identify them. Most modern smartphones now have emergency medical ID features that display critical information even when the phone is locked. Take time right now to set this up with your medical conditions, medications, and emergency contacts. Seriously consider investing in a medical alert system, especially if you live alone. Modern options go far beyond traditional pendant-style devices. Smartwatches with automatic fall detection and emergency calling features, GPS-enabled devices for active seniors, and systems with two-way communication are all readily available. Choose one that fits your lifestyle and comfort level with technology. Make your home easily identifiable for emergency responders who may be unfamiliar with your area. Ensure your house number is clearly visible from the street, preferably with reflective numbers that can be seen clearly at night. If you live in an apartment or condominium, make absolutely sure the building and unit numbers are clearly marked and visible. Practice your emergency response regularly, like you would practice any other important skill. Actually walk through all the steps, where you would sit, where your aspirin is located, how quickly you can unlock your door, and which position feels most comfortable for breathing exercises. This isn't morbid preparation. It's practical life insurance that builds crucial muscle memory for when clear thinking might be compromised. Have honest, detailed conversations with family members or trusted neighbors about your comprehensive plan. If you live alone, consider arranging regular check-in calls, especially if you have known heart risk factors or other health concerns. Review and completely update your plan every 6 months, or whenever your medications or health conditions change in any way. Medical information becomes outdated quickly, and emergency responders absolutely need current, accurate information to provide the best possible care. Have you created an emergency plan for yourself or an elderly loved one? Share your experience or questions in the comments below, and if this video has inspired you to create your own plan, let me know by hitting that like button right now. Your heart's greatest victory. Let me tell you the complete story of the woman I mentioned at the beginning of this video. At 74, she was an active woman who lived alone after her husband passed away. One evening while preparing dinner, she began experiencing what she later described as unusual fatigue and mild nausea. Nothing like the dramatic chest pain you see in movies. Because we had previously discussed the warning signs specific to seniors, she recognized these subtle symptoms as potential heart attack indicators. Instead of brushing them off as just being tired, she immediately stopped what she was doing and activated her carefully prepared plan. She called 911 first, then chewed an aspirin she kept in her kitchen drawer while sitting in an upright, supported position. She focused on her breathing using the 4-7-8 technique we discussed. Most importantly, she had her emergency information card ready and her front door unlocked, habits she had developed as part of her heart attack action plan. Paramedics arrived within 10 minutes and immediately began advanced treatment. At the hospital, doctors confirmed she was having a significant heart attack with a 90% blockage in her left anterior descending artery, often called the widowmaker. Because of her quick response and the steps she took while waiting for help, she suffered minimal heart damage. 6 months later, she was back to her active lifestyle with just a few medication adjustments and a profound appreciation for preparation. These 7 strategies transform you from a potential victim into an empowered survivor. Your heart has carried you faithfully through decades of life's greatest joys and most difficult challenges, and now you have the knowledge to support it through its greatest crisis. If you found this information valuable, please hit that like button and share this video with someone you care about. You might just save their life. Subscribe to our channel for more life-saving advice specifically designed for seniors, and ring that notification bell so you never miss our latest health tips. In the comments, let me know, which of these 7 tips surprised you the most? Have you started creating your personal heart attack action plan? And most importantly, will you share this with 3 people you care about? Your action today could save a life tomorrow. Before you go, I have one final request. Please share this video with at least 3 people over 60. You never know whose life you might save. If this video helped you feel more prepared and confident about handling a cardiac emergency, let me know in the comments below. Stay safe, stay prepared, and remember, you're never powerless against heart disease When you have the right knowledge and preparation,